Hi, everyone. Welcome to the first science podcast available on iTunes through our own RSS feed. Don't worry, we'll continue to post the ASF podcast on YouTube for our audience that doesn't entirely understand what an RSS feed is. And by the way, that includes me. We'd received many requests to post the podcast on a podcasting service and wanted as many people to have access as possible. I want to give a huge shout out to Esther Zhu, our amazing summer intern from University of Pennsylvania, who spent countless hours helping us get this all figured out. I have renewed respect for tech geeks, and I say that in the most respectful way. If you want to find Esther next year, she'll be chained to our radiator, helping us with everything we need to know about technology. Obviously, I'm kidding, but that thought has crossed my mind. Okay, so on to science. As you know, we've been closely following the science around differences in symptom presentation in males and females with autism across the lifespan, and based on a few recent analyses, differences have not obviously emerged in the first few years of life. But scientists are looking more and more closely in an effort to better detect girls with autism and to ensure they aren't overlooked. Dr. Clare Harrop at UCLA published earlier this year on social and communication function and now looks closer at repetitive and restrictive behaviors. Previous studies had shown that girls show fewer of these repetitive behaviors compared to boys. So what this study does was to examine a small group of boys and girls younger than 5 years and look at them very, very closely and try to understand when these differences are seen and if they can be predicted by any specific features. They looked really carefully at the types of repetitive behavior seen, when they were seen, and how they were focused. I'll let Claire describe her study more, and as you'll hear, her voice is much more pleasant than mine anyway.
My name is Clare Harrop. I'm a postdoc at UNC Chapel Hill, and I'm going to talk today about a study that has just come out in the Journal of Autism and Developmental Disorders in collaboration with colleagues at UCLA. This study looked observationally at the repetitive behaviours of 29 girls with autism who were matched to 29 boys. These children were between 2 and 4.5 when they were recruited to the study, so they were quite young. And the reason we were interested in looking at this core domain of autism were due to recent findings that have found that girls may have fewer repetitive behaviours, though this typically has not been observed before around 5 or 6 years of age. There were also 2 recent studies from Rachel Hiller and colleagues in Australia that found that there were qualitative differences in the types and content of repetitive behaviours in young girls with autism. In our study, we found no significant differences in the overall number or types of repetitive behaviours. What we were really interested in, however, was looking at the association between age and repetitive behaviours. We found that the older boys in our sample displayed more repetitive behaviours relative to the older girls. While we can't infer trajectory differences with this being a cross-sectional sample, this really points to the need to study these behaviours longitudinally to look at whether gender differential trajectories exist in this core domain of autism, and if so, when do girls and boys with autism start to diverge from one another?
So what does all this mean? Claire explains.
The reason we may not have found differences in our sample could be in part due to the fact that these girls were recruited very young. Therefore, they may fall into the lower end of the spectrum where we know that the gender ratio in autism is reduced. So what I really think we need to do is look at the trajectories of these behaviours over time, but also across the spectrum, including high-functioning girls in our samples, to see how they differ from high-functioning boys.
As Claire said, while there were no major differences between toddler boys and girls, it's important to make sure that researchers don't just look at one age and then stop, assuming those differences are going to remain static across life. The best way to do this is through what's called a longitudinal study, but those take a lot of time and they're expensive. But in the end, we can't expect that the symptoms and features of someone at age 2 are going to stay the same at age 10. And this sort of information is necessary to understand both the symptoms and the treatment of debilitating symptoms across time. While we can all get excited about new findings from individual studies that are novel, interesting, and innovative, it's important to take a step back and take a big picture perspective of multiple studies in one area so that scientists can understand the finding and how these findings can be translated into clinical practice. Remember, doctors are not going to take a novel finding from just 10 people with autism and immediately change what they're doing. But they might take the results of 10 different studies all saying the same thing and be able to do something with that. Last week, a meta-analysis and systematic review was published on psychosocial interventions for anxiety and autism. This means the data was combined and reanalyzed, and the study designs were critically evaluated. This particular analysis from researchers in Scotland took 10 different studies, including over 400 individuals who had been enrolled in studies looking at cognitive behavioral therapy, or CBT, for treatment of anxiety in people with autism. In cognitive behavioral therapy, people are taught to alter their thinking patterns to change maladaptive behavior. In short, it helps people replace some thoughts with more adaptive ones. It's been proven successful in depression and anxiety, but remember, anxiety in people without autism. It's also being studied in other disorders. The researchers organized the studies by whether the symptoms were reported by the person with autism, their caregiver, or a clinician. Also, they looked at whether the therapy was delivered in a group versus individually. By examining these variables, they showed that, in fact, CBT was better than waitlist or nothing for treating symptoms of anxiety, and that group therapy really wasn't helpful, but individual plus group therapy was. One thing the authors noted is that there was no good way to measure anxiety in people with autism. There are multiple types of measures for anxiety, but it's not clear how well they measure anxiety in people with autism. I'm happy to report this is something that the funding organizations are all trying to address. ASF is funding a project from Drexel that's going to validate a measure of anxiety in people with autism. The Simons Foundation issued a special funding mechanism to develop new measures of treatment outcome in people with autism, and Autism Speaks organized multiple meetings and sponsored the publication of 3 articles which outline the measures that were currently being used, how, and whether they were judged to be appropriate for use in treatment trials. One of these publications focused on anxiety in people with autism. Clearly, we need better treatments, so we need to know if they work or not, and the first way scientists do that is with good measurements. Thank you for listening this week, and I look forward to talking to you next Friday.